Thank you, Dr. Knable. Hi, everyone. I'm Tina. In case you don't know me, thanks for Dr. Knable's introduction. And as you have read the description of my project, I'll be presenting my advanced study about how music treatment help for mental disorders like epilepsy. So just some quick background introduction that I have read this book called Patient HM, introduced by Dr. P in my freshman year summer. And it's about this, the story about this guy called Harry, or Patient HM, who was injured from a bike accident at the age of 17 and was thus diagnosed for epilepsy. And contemporarily, lobectomy of brain, which also means the resection of brain, was considered as a safe and straightforward treatment for mental disorders. So Harry received this operation from the author's grandfather, who was a very famous neurologist by the time. But from the moment he can only be kept his memories for only tens of seconds. Before reading the book, I barely know nothing about epilepsy or other mental disables as well. I've really intrigued by how fascinating humans' brain and memories could be, and also the importance of mental diseases proper treatment. So that's basically how I was inspired about this topic. So epilepsy, it is a central nervous system disorder in which the brain activity becomes abnormal and causing seizures or periods of unusual behaviors, sensations, and sometimes the loss of awareness of the patient. Anyone can develop it. So the central nervous system is, as the picture shown, consists of the brain and the spinal cord. The brain plays a central role in the control of most our body functions, like awareness, movements, sensations, thoughts, speech, memories, of course. And the spinal cord is connected to the section of the brain. You can see in this picture is behind the cerebellum called the brainstem and run through the spinal canal. It carries the signals and messages back and forth between the brain and the peripheral nerves. We won't go really deep into that, or it could be a whole nother project. So just a little intro. The causes of epilepsy are varied. When neurons and electrical activities in brain suddenly fire abnormally, there could be brain dysfunctions like epilepsy. And it is usually shown in two types. One is called generalized seizure, and another one is called focal seizure. The generalized type would cause a full dysfunction of the patient's body. So people will basically just pass out. And the focal seizure will cause partial unconsciousness or loss of physical or mental control. 60% of the epileptic seizures are focal, and the rest, 40%, are usually generalized. There are many symptoms of epilepsy as well. The clinical manifestation of epilepsy are complex and varied. Sometimes it can be manifested as episodic motor or sensory or autonomic nerves or consciousness or even mental disorders as well. Sudden loss of consciousness and systematic tonicity and convulsion, like this little guy at the middle top, is called comprehensive tonic-clonic seizure. The duration of this type of seizure is generally less than 5 minutes and often accompanied with tombite, loss of bladder, urinary inconsistence, and it's easy to cause injuries such as suffocation. other types like abrupt occurrence and gazing into the space like this little guy is called absence attack. It can happen in a blink of an eye, but basically not companion or just companion with a little motion symptom. It would also end really abruptly. And it's the shortest symptom among all of them that usually only happens between 5 to 20 seconds and really more than 1 minute. Another common type is called myoclonic seizure. It's sudden, unintended muscle contraction that are usually caused by genetic factors and also maybe cognitive and developmental problems that we could encounter during juveniles. It's also the most common syndrome. The muscle sudden rapid or short of contraction, and the performance is similar to body or limb electric shock like shake. Sometimes it can be consecutive for several times and more than appear after awakening. Epilepsy is getting to become a common but also complicated mental disorder on the world. Over 65 million people are affected by that, and about 2 to 3 million new cases are going to happen each year. So basically about 1 in 26 people will develop epilepsy at some point during their lifetime. So the treatment for this mental disorder is especially important. The current treatment for seizures and epilepsy are growing mature, including medications, surgery, diet, neuromodulation, and of course, musical treatment, which we'll dive deeper into today. The medication is the first-line treatment, but surgery is an option for some severe cases. Most people, like around 70% of the patients, through normal anti-epileptic drug treatment will be cured in about 2 to 5 years, and 50 to 60 of them will be cured completely only on drug treatments. Something like sodium vaporate or Epidiolex are very common medication of epilepsy. Very interesting that the Epidiolex is actually the condensation of wheat leaves that is used for mental disorders or other mental diseases a lot. So surgical treatments has been developed a lot in the recent 100 years as well. The lobectomy that I was talking about went through is the most common operation for epilepsy back in the days. It removes the connecting tissue of the prefrontal cortex and the part of the anterior temporal lobe along with the medulla and hippocampus. The prefrontal cortex, it's right here. It's the cerebral cortex covering the front part of the frontal lobe. The brain region has been implicated in planning complex cognitive behaviors and other things like personality expression, decisions making, and social behavior moderating as well. The temporal lobe is right here below the frontal lobe. It processes memories, integrating them with sensations of taste, sound, sight, and touch. It was largely used, this lobectomy was largely used from 1930s to 1950s, and it was also the world's first psychiatric surgery. The man right here in this picture is the Portuguese neurosurgeon who introduced this surgical operation, and he won the Nobel Prize in medicine in 1949. However, the current evaluation of this operation is usually negative. It has been banned for the Soviet Union in 1950 and was banned by most of the countries, including most of the states in the US in 1970. It's mainly because there's no objective or credible standards for evaluation of the post-operative effects. The appearance is that the impulsive mental patients are in a state of dementia after surgery, which is easy to manage. So in the case of Henry, after going through the operation, he just completely lost all of the memories that he had before and couldn't make any new memories at all. So that's kind of considered a violation of human rights, and that's why the reason this surgery has been banned. The physician who did Henry's surgery is this doctor in the middle looking at the X-ray. He actually innovated the process of the lobectomy and reduced the difficulty to operate. He would just use a tool similar to a knife cone, something look like this, and a hammer, and the patient will be given electric shocks and they'll pass out on a table. And during the operation, he will use the chisel to chisel the brain, this ice cone thing into the brain through the upper part of our eyeball, and the corresponding nerve system will be destroyed. This process will be really fast, and in some cases, it can be performed even without the operating room, just on a random desk or table. So even though this resection surgery leads to a significant reduction, control about 70% to 80% of the seizures at the time. However, the patient's memory and language can be affected largely because it's performed on the dominant brain hemisphere. Now it's time to really talk about music therapy. The idea of music as a healing influence, which would affect health and behavior, is at least as old as the writings of Aristotle and Plato. And maybe in some countries or cultures, it could be longer than that. The first recorded music therapy intervention or systematic experiments were conducted in the 1800s. It's kind of clear and easy to explain how our brain and music would have the relationship. As any other types of waves, like light waves or sound waves, brain waves also have amplitude, period, and power. And each of those corresponds to a feature of music, which are the pitch, duration, and volume. So when all of them are matched on the same level, dopamine will be released and the perception of the brain can be reduced, or at least the patterns of pain or depression or disability or disorders can be altered to something else and be released in other chemical matters. The scientists have also tried on multiple genres of music to see which type will work the best to help with mental problems. So back in last century, when the Queen was really popular all around the world, some people will suggest that We Will Rock You is actually the best music that will help for mental disabled, because it has such a emphatic rhythm and strong melody that does help for the rehabilitation of speech and language and some cognitive functions after the people get a stroke or a brain injury. But after examination for genres overall, orchestral musics usually work the best in most circumstances. So here comes to our friend and the protagonist of the project, Mozart. Listening to Mozart, especially every day, can significantly reduce the seizures by 31 to 66% on average. And it can also reduce the abnormal brain activity in patients with epileptic form interstitial discharges. This effect occurs this can be after a single listening session and are maintained after a long period of treatment. And among all of his works, his piano sonata K448 is the most used music in the study for, this one, for the brain examination, for its perfect symmetrical pattern and the beautiful dynamics. Some researchers, lots of researchers have done experiments on this piece of music, and according to Journal of the Royal Society of Medicine, patients with epilepsy are listened to this piece for 10 minutes, and after that they found the patients has improved their spatial skills, such as paper cutting and paper folding. Other experiments have done on mice showed that the mice who have listened to this sonata would walk through the maze faster than the other mice who did not listen to the music. It's written in 3 movements. The first one is Allegro conspirato. It's written up here really small. Sorry, it's really small. Allegro means cheerful and lively and generally in a relatively fast speed. The second movement is in andante, which is a moderate slow tempo. And the third movement is molto allegro, which means slightly faster than allegro. The first movement begins in D major, and it sets off the tonal center with a strong introduction. The 2 pianos divided the main melody for the exposition, and when the theme is presented, both play it simultaneously. And we'll actually take a listen to the piece.
100% 재활용 용
All right, so it really follows the strictest, the most strict pattern of the Allegro sonata and gives a lively, upbraining vibe that helps the brain to get into a to help the brain get stimulated. And the entire second movement has switched the tone and played in a relatively relaxed pace. The melody is still played by both pianos, but there's no strong climax or conflicts in this movement. It's written in a soft but also sweeter pattern. We'll see this one. All right. Okay, so as you've listened, it's really the differences between the first two movements are really clear, and only by looking at the script and the number of the scores on the script, you can tell that the first one is much more upbringing and lively than the second movement. And the third movement, Molto Allegro, begins with a galloping theme. It has the greatest cadenza that emphasize on Mozart's mindset and also the upbringing tempo of all the works. really great. And according to the British Epilepsy Organization, the researchers have suggested that this K448 have been the greatest Mozart's effect in the listening to the piano sonata, improved spatial reasoning skill, and reduced the number of seizures in people with epilepsy, because the format of this sonata is strictly allegro sonata, which started with a relatively strong beat with a fast tempo. And this type of music will stimulate brain waves. And the second movement turns to slow beats and soft turn waves. This kind of music encourages the slow brain waves that are associated with hypotonic or meditative states. In the third movement, it returns back to the faster beats that encourage more alert and concerning thinking. So overall, it has a kind of like ABA format that really stimulates all the functions of our brain. So it's widely known for the best example of Mozart effect, and has been used a lot in the diagnosis and also rehabilitation of the brain disorders. Apart from Mozart's work, there's one other piece that can be found have similar effect as this one. It's a piece written by the Greek composer called Yani, and maybe his works are widely known as the Nightingale, and he will perform in a lot of historical places in different countries. So I think we could take a listen at this one as well, as it has the similar tempo structure and harmonic consonance as Mozart's piece. All right, so it's also orchestral music, but in a more modern and just more modern style. And it has relatively similar tempo and predictability as most of Mozart's piece, although in a different presented manner. So in my initial expectations, my presentation should be pretty much done by here. But when I was meeting with Dr. Knebel at the beginning of the semester, as the best advisor ever, she was like, why don't you compose your own concerto, your own sonata, and maybe you can mimic the style of Mozart's. And I was like, are you sure you want me to do that? Because I have no idea how that's going to turn out to be. But I have tried my best to compose another correspondence section that kind of condensed the three movements into 1 minute, like baby Mozart's sonata following his original motifs. And I have tried to emphasize the changes in dynamics from like strong to moderate and sweeter, and then to stronger. So please bear with my limited music composition skills, and yeah, I hope it's okay. If it's not, I'm really sorry. Yeah, so that's it. I have tried my best to kind of mimic Mozart's iconic style of lots of semi-quivers at the bass clef, and I use lots of staccatos in this as well, and hope at least it's somehow similar to his works. But yeah. And I think now we have time for any questions or just anything, basically.
So I'd love for you all to ask Tina some questions about the process or more specific things about what she was able to do, maybe challenges she faced, things like that. If you would like to ask a question, then please come to the center aisle and come toward the computer a little bit just to make sure that she can hear you.
Hi, Tina. Thank you very much. Quick question about current research and music therapy. Any dives into ways in which music can be used in therapeutic settings currently?
Sorry, I couldn't really hear you. I think it's because of my...
Okay, can you hear me now?
Yes, sorry.
Okay. First, thank you very much. Really enjoyed that. Question about current thoughts and thinking or research about music in therapy in today's society. Do you come across any current thinkers or research along those lines?
Yes, of course. It's generally still a kind of new idea comparing to traditional treatments like medications or surgeries, but it's widely used in many kinds of disorders or disabilities, not only related to brain, but also other physical things. That just overall music therapy does the work to cheer people up. And when people listen to music, they release dopamine, and it just helps people to getting from a better mood from the depression. But also, it couldn't take away the help of the medicines or the surgeries. It's usually seen as a side effect or second-handed helper that add on to the medicines or the drugs or the operations. Hope that answers the question.
How long did you make this piece of Mozart music, and then what is the mindset that you have while making this piece?
It really, like, although it's just a minute-long music piece, but it took me most of the time working on this. I know I couldn't write, because the original sonata was like 26, 27 minutes. I, of course, cannot write something like that. So I just tried to keep the format as stronger with faster speed to slower, softer tempo, and back to the faster speed again. Hope y'all can hear that. Or so I've listened to lots of Mozart's music by this time. I've started to work on the music piece as the semester started. I was doing the research-based thing last semester, and I've mimicked the melody from other musicians as well, and trying to get lots of insights from different people and composers and see that would be helpful. So basically my mindset was trying to keep the format and try to correspond to the style of Mozart that's lively, upbringing, and relaxed as possible.
Hi. I was wondering, when you composed this, did you sit at a piano and compose it, or did you do it on the computer? Like, how did you actually like write out the tune? I know it was on the program in the end, but did you write it at a piano?
Yes, I was just browsing and see what kind of tool can I use, because I never composed anything before. I like barely used GarageBand. So I just found this website that you can just put scores on this. You can make additions, and I would just sit by my piano and listen to music at the same time and see if there's any possible melodies coming to my mind, and I'll draw it down. And you can make changes, so it's pretty helpful. I don't know if this is a professional score writing website at all or something. Maybe it's really crappy or or really for professional people, but that's all I can do for this piece.
Hey, Tina. I think my next question is just, what comes next for you? Like, now that you've had sort of a taste of composition, are you going to continue to work on this piece, or, do you have ideas for other things? Like, what would you, if you were to continue your work, what would you do next?
I mean, I have done other research before. I found out that I'm probably more like a research type of person instead of composition. Like it really took me 4 months to write this short part of music. So I would love to keep writing on this and keep like make progresses and make it longer pieces. But I think I'll turn my focus more back into the research base, like reading articles or just look at documentaries about this new discoveries about either things related to epilepsy or something else.